This is the news at 4.
St. Luke's will soon offer COVID-19 vaccines for younger children between the ages of 6 months and 4 years old.
Yeah, today they held a media briefing to update the public on what parents can expect.
We are anxious to open this up in the next week or two to our patients once we have the necessary materials in place.
St. Luke's Dr. Kenny Bramwell, along with Dr. Laura McGeorge, about the rollout for the COVID-19 vaccine for children as young as 6 months old.
We want to make sure that we really get it right.
The FDA and CDC approved the Moderna vaccine for children ages 6 months to 5 years old, as well as the Pfizer vaccine for children ages 6 months through 4 years old.
A couple of things about the Pfizer vaccine is it's 3 doses. It's a little tricky. 3 weeks from dose 1 to 2, and then waiting 8 weeks until the 3rd dose.
Keep in mind, those doses are tiny. Dr. McGeorge says the dose for children ages 6 months to 5 years old is just 1/10 of the dose used for adults. And for Moderna,
this one is 2 doses about a month apart. This is 1/4 of the initial adult dose.
she adds safety is the top priority.
The pros of getting vaccinated is really reducing the likelihood of very serious infection, which can be hospitalization and just incredibly rare mortality. But to reduce that, also the vaccines still reduce minor infections, which means less missing school, no need to cancel that upcoming vacation with grandma. Parents don't need to miss work because the kid is homesick with COVID.
Dr. Bramwell says when it comes to children being hospitalized, things overall are going well.
January was the highest number of pediatric patients that we had admitted to the Children's Hospital for COVID in the entire pandemic. We had 55 patients admitted during the month of January, and through much of the rest of the pandemic, the average has been 5 or 6 patients per month.
He adds they are not busting at the seams like they were because of COVID in the winter.
We're at a much better spot now across all ages for the number of people who need to be admitted to the hospital, which is great.
And both doctors say this can be confusing, so don't hesitate to talk with your medical professional or a medical professional. They also don't anticipate any supply issues with the vaccine for these young children. But one thing to note, they're also not anticipating vaccines for these young kids to be available at pharmacies like Albertsons as they were for adults.
And Sherry, I think some parents may be concerned about the strength of the doses,
Right.
but in your piece you talk about how for a baby it's only like 1/4.
Right, so 1/10 of the dose that adults were seeing. So it's very tiny, very small doses.
A smaller percentage.
Yes.
Okay.